Belgium, I'm a medical oncologist. I'm involved in treatment of cancer patients since 10 years. And as you know, in Belgium, we have a euthanasia law since 2002. I think it's a good idea to look to the Belgian experience and to see what can happen if a law on euthanasia can be applied. The first thing that you see in Belgium is that there is an increase in the number of demands for euthanasia. Now we have 1,800 a year, and this is increasing at a high speed level. I think it increased by 40% since last year. In the beginning, 10 years ago, euthanasia was meant for terminal suffering, for pain difficult to control in other ways, for suffocation, anxiety at the end of life, situations where the doctor could not find a way to alleviate. But little by little, the question of autonomy and the lack of sense of life, the meaning of life in the case of disease, came more and more upfront, and now patients are asking for euthanasia even if they are not terminally ill. The Belgian law does not mention the word terminally ill. It's enough to be ill, to have an illness for which there is no cure, but you don't have to be in a terminal state. The consequence is that last year 15% of the patients who underwent euthanasia in non-terminally ill conditions. And this number is growing. It has doubled over 5 years. So I expect that by 2018, 30%, so 1 out of 3 patients who will ask for euthanasia will not be in a terminally ill situation. So it's not rare that from the first consultation with an oncologist, when you announce the diagnosis, the patient is already asking for euthanasia because he's afraid of suffering, he's afraid of losing his autonomy. There is a fear of the suffering which could come, but we even didn't talk about the possible therapeutic options. Already now they ask for euthanasia. So one of the big motivations for some promoters of the law in Belgium was autonomy. So it was not only that euthanasia should be allowed for patients in terminally ill situations with difficult to control symptoms such as pain or asphyxia or terminal anxiety, but also the case of autonomy. I'm an autonomous person, so I can decide when to die, when to live. That's my decision. And also, if I feel that my life is not worth anymore to live, I would have the right to die now, and people should help me, or doctors should help me. And this autonomy reasons was not put in the foreground 12 years ago, because it would not be accepted. They put in the foreground the physical suffering, but now little by little this reason of autonomy is in the foreground. And for me this is a problem because I think that with this law the doctor's autonomy is also in danger. There is a high pressure to go for euthanasia, and also in 2002 the law has foreseen that doctors who would have problems with their conscience, they should not be obliged to go for euthanasia. So they said, we will respect it, we understand that it's difficult, so if you don't like to do it, you will not be obliged to do it. And only 11 years later, there were several proposals for new laws, extension of the law, telling that doctors who would not agree to do euthanasia should refer their patients to a colleague who will do it. But for me, this is like a collaboration to euthanasia. And it is very astonishing that in 10 years of time, the same persons who said we will respect your conscience, now they say we will oblige you to refer. So this is really a lack of respect of the autonomy of the doctor. This is for me very surprising, because one of the biggest and even the most important value of the promoters of the law on euthanasia is autonomy. So they respect the autonomy of the patient, but they don't respect the autonomy of the doctor and the nurses. And nowadays, only 40% of the patients with a demand for euthanasia, and which will undergo finally euthanasia, will have a palliative advice. In 60% of cases, it's even not. They even don't think on palliative care alternatives. A lot of doctors, once they are in front of the diagnosis of cancer, they can think, oh, there's nothing anymore to do, chemotherapy doesn't work, you only have 6 months to live. And that can be false diagnosis and a false prognosis. So if these patients, when they have seen a doctor who is not aware of the last therapies and the therapeutic options, if these patients ask for euthanasia, they could maybe even obtain it, because they have not had the possibility to obtain the right medicine. And this, I can tell you examples of this. So this is also euthanasia is putting a patient's life in danger. It's a bit strange to say it in that way, but it's like that. One of the problems we see in patients asking for euthanasia is that they don't want to be a burden for their family. It's quite often that it occurs that this is the reason that they say. So recently, some months ago, we had a patient, a 72-year-old woman, who was end-stage disease of breast cancer, and she was receiving a therapy. She came to the Audi clinic, and the fellow came to see me, and he told me, look, I think that this patient who came for her therapy, well, she wants euthanasia. So I went to see her, and I took half an hour to talk with her. And she gave two reasons. The first was that she was a bit tired of the therapy. The second one was that she was thinking that she became a burden for her family and for her daughter in particular, who was present there in the room, because this daughter had her own kids and had her job, her work, and it was a bit difficult to take care of the mother, or at least she thought that it would be difficult. So I agreed with the patient on her first point, that indeed she was at a very advanced disease stage and that this therapy was not so useful. So it was a burden for her to come to the hospital, and we agreed that best supportive care at home would be the best. And then remained the question of to be a burden for the family. So I told her, in your life, did you ever take care of someone else? And she told me, yes, I had my father who had cancer for 4 years, and I was treating him at home almost all the time I was with him. And when he died, then my mother became ill, and I took care of her during 6 months. And I asked her, was this a burden for you to take care of your parents? And she said, oh no, not at all. I felt really happy and really, it was for me, it's a good memory also, it was a good time for me to take care of them. I really felt happy. And before that I could say anything else, the daughter took the feet of her mother, started crying, and she told to her mother, please mom, let me now take care of you, because this daughter wanted to do this. This was the last thing in her life she could do for her mother. She wanted to do it. So patients do not have to think that they are a burden for their family. Instead of this, they offer them a possibility to grow in love, and this is the most important in life. The most important is not autonomy, the most important is love. And illness is a situation in which people can discover again that you can be happy, giving love and time and care to another. Some promoters of the law in 2002 said that there was a kind of gray zone, a shadow zone, between palliative care and euthanasia. They said that doctors who were doing palliative care and administering morphine or sedatives could shorten a patient's life and therefore be accused as murderers. And they said that this was a shadow zone and could be dangerous for doctors, so this was one of the reasons to legalize euthanasia. Another reason to legalize euthanasia was the fact that euthanasia was already put into practice. It was done, but it was done in a covered way without telling nothing about it. So it was done in an illegal way, and they wanted it should be better that it was legal. And therefore there was the proposal, these were arguments in favor of the proposal of a law on euthanasia. Well, I can say you now that this is a false argument. You can see it in Belgium because there was a study published in an international journal showing that in Flanders about 73% of all euthanasias were declared, and in Wallonia 58%. So this means that even with a law on euthanasia, in Flanders 27% and in Wallonia 42% of cases are not declared. So there is still a kind of illegal euthanasia, and you can make the calculation. It concerns almost 800 patients a year in Belgium. So this law on euthanasia did not put all euthanasias in the legality. On the opposite, there can be more euthanasias now illegal because euthanasia has been promoted in a very active way. If you really want to protect doctors who are in palliative care and who, without the intention to shorten life, are treating patients with morphine or sedatives, if you want to protect them that they will not be pursued if ever a patient would die earlier because of their therapies, then you can make a law on palliative care in which you say very clearly that as long as a doctor is administering palliative care, morphine and sedatives, in order to control specific symptoms as pain, suffocation and anxiety, that he cannot be pursued as long as he has given the right dose with proportionality and with the right intention. I think this is a way also to clarify this shadow zone, and I think this solution will be better than to legalize euthanasia.